On average, we visit our GP 6 times a year, and every year that GP will deal with around 10,000 appointments. In fact, GPs are now responsible for delivering 90% of patient care in the NHS for less than 9% of its budget. But it's not sustainable. This film explains the challenges facing GPs and 3 of the changes taking place in our area. A wider team of people to look after you, our GP practices working together, and technology to make life easier for everyone.
The workload is going up. The number of consultations we're having to try and squeeze in is going up. The complexity of the patients is going up, but actually the GP workforce hasn't gone up.
Day on day demand is increasing, and I think we had somewhere in the region of 25% more consultations last winter.
Good morning, Bedford Surgery.
One of the big concerns is that GPs will be retiring and there are no new GPs coming in to take their place. Where we are currently is not really sustainable, and we need to do something differently to be able to look after them going forward.
One of the ways to do that is to release GPs on patient issues that can be safely dealt with by others. Here in Berkshire West, we're introducing 2 new roles in primary care: physician associates and practice pharmacists. A physician associate has a life science degree followed by a further 2 years training in a clinical setting. The physician associate is a qualified clinician who can diagnose and treat patients under the supervision of a doctor.
I'll come in and do a walk-in surgery, typically speaking, in the morning. So that means that any patient that turns up between 8:30 and 10:30 will be seen. And that can mean that I see a patient who has got an acute sore throat, that has got a problem with their muscles or aches and pains, or needs a repeat prescription, needs a medication review, needs some advice. And all of my clinics, be that the walk-in or be it the booked appointments, I have a designated supervising GP that I can speak to at any point.
Practice pharmacists come with a background from looking after drugs and dispensing drugs, but a lot of their training is behind the clinical reasons for using drugs. And so they, with a bit of extra training, are able to deal with minor illness. Then they can expand that into chronic disease management.
With community pharmacy, it's more when you see the patient bringing a prescription in, you dispense it, you give them the advice, and then hope that they take them correctly. With GP practice, you sort of go behind the scenes about actually how the prescription came about. So it's more about understanding what happened to the patient that led the GP to decide what medication was right. Patients will notice better care, I hope, and see us helping them managing all their long-term medication, long-term conditions, empowering patients and making sure that they make the most of their medication.
A wider team of people to look after you is just one of the changes we're making to rebalance the scales. By seeing the right healthcare professional for your problem, we can make sure that GPs have the time to see the most complex conditions. We've listened to your feedback, and the second big change we're making is GP practices working better together, collaborating to meet patient needs. This could mean visiting a neighbouring practice for an urgent on-the-day appointment or a specialist clinic. Where it's right to do so, some GP practices may choose to merge in future or to work together to provide certain services. And some may develop new premises, like this one under construction earlier this year.
With size means that we can increase our economies of scale, that our back office will hopefully become more efficient. It also means that our extended hours can become more varied. We can offer more extended hours on more days and for longer periods of time.
The third big change in our plan is better use of technology. To provide the best possible care, health and social care professionals need the most up-to-date information about you. GPs in Berkshire West can access and update your records remotely, and we're now working to allow other care professionals to view information from your medical records with your permission.
Does the doctor on call have permission to look at his GP records?
This means that if you need urgent care, the people who care for you can do so without relying on you to remember information about your medical history. Already, new technology is helping patients to book appointments online and order repeat prescriptions. In the future, new technology will also mean that you can update your details through an online portal and even attend consultations with your health professional over the telephone, email or online video. And with the onset of cheaper monitoring technology, we hope that some patients with long-term conditions will be supported with wearable devices to remote monitor their condition. A wider team of people to look after you, our GP practices working together, and better use of technology are all part of our vision for developing primary care services in your area.